So in this chapter, we will continue on learning about the cardiovascular system and specifically focus on one of our most integral organs, the heart. The heart's major role in the body is serving as a pump to pump blood systemically through the blood vessels. So the heart is the second major component of the cardiovascular system that we will discuss. And after this chapter, we will get into the blood vessels. But for now, we need to understand a few things about the heart as we progress through the cardiovascular system as a whole. One of the first major topics we will cover in this presentation is the anatomy of the heart. We're going to go over the channel and chamber system that can be found in the heart. And we're also going to talk a little bit about how the heart contracts involuntarily and continues pumping blood throughout our life. We will discuss some cardiac physiology, discussing concepts such as heart rate, cardiac output, the cardiac cycle, as well as understanding EKGs. So without any further ado, let us continue on and start learning about the components of the heart. So some of the initial gross characteristics of the heart that we see is that it is found in this little area known as the mediastinum. That's what's within this dotted line shown here. The heart is found squeezed between the two lungs, and it's found right here behind the sternum. The heart has an apex as well as a base. The apex is this portion down here, and the base can be found up here. Now I know that's a little counterintuitive. Typically the apex of something is at the top and the base is at the bottom. But due to the structure of the heart, we will find the apex found here, very close to the diaphragm. And the diaphragm is where the heart is going to be sitting at. So the diaphragm is this bowl-shaped muscle, and we can describe the diaphragm as our muscle of breathing. It's this bowl-shaped muscle that when we contract, it's going to flatten out. And when the diaphragm contracts, it's going to pull the lungs open and also push the abdominal contents out and downward. So the heart directly sits on top of the diaphragm. Again, the apex is the portion of the heart that it's going to sit on the diaphragm. This is going to be one of the more muscular parts of the heart. Remember, we do have a special type of muscle in the heart known as cardiac muscle. And so this apex is going to be part of that. And the base is going to contain the major blood vessels that are projecting out from the heart. These vessels are our body's largest arteries and veins, and those will serve the function of carrying blood to and from the heart. Now shortly we will start learning the different anatomical parts of the heart and start learning how to identify different structures on it. However, we first want to go over a serous membrane that is found surrounding the heart. So typically when we learn the heart, I think it's more effective if we go superficial to deep. So we would have heard of the pericardium in A&P 1, but in case we don't remember, the pericardium is a serous membrane that is found surrounding the heart. Serous membranes are closed cavities, which means that there are no openings in or out of the cavity within the serous membrane. So you can see this sort of makes a balloon-shaped structure, and the heart will be impressed in this balloon, and it will wrap around the heart, and that is our pericardium. We'll also have the serous membranes that can be found around the lungs. Those are called pleura, and we'll have the serous membrane that is found in the abdominal cavity, known as the peritoneum. So after our organ has been positioned within the serous membrane, we're going to find that there are two layers. There's this inner layer that actually contacts the heart tissue itself, and then this outer layer that's not directly contacting the heart, but it will contact other structures around the serous pericardium. Each of these layers has their own name. The outermost layer is the parietal layer, and the innermost layer that actually contacts the organ itself is known as the visceral layer. Tissues within our body is referred to as viscera, so we call this the visceral layer since it contacts the heart itself. Now, keep in mind that there will be a little space that's found between these two layers. This is going to be known as the pericardial cavity, and it is serous fluid that is filling up this pericardial cavity. The purpose of the serous fluid is to lubricate these two layers so they can easily slide past one another and prevent friction within the body. Normally, throughout our daily lives, we are constantly contorting our bodies in different positions, and that's going to lead to our organs often rubbing past one another. So the serous fluid helps to prevent friction and keep our organs from grinding past one another and causing damage. So unfortunately, we do have some pathologies that are strictly related to the pericardium, and that is known as pericarditis. The suffix itis means inflammation. So pericarditis refers to an inflammation of the pericardium. And we have this in two forms. We have the acute type and we have the chronic type. The acute pericarditis is a bit more common than the chronic form. However, this is going to have a very sudden onset, and we don't really know the cause behind why the acute form begins in the first place. It is thought that this acute pericarditis is caused by viral infections. However, the typical treatment for acute pericarditis are different types of inflammation-reducing drugs, such as aspirin or ibuprofen. The chronic form of pericarditis is a bit more serious and, as the name implies, a bit more long-lasting than the acute pericarditis. Oftentimes, with chronic pericarditis, there is a buildup of the pericardial fluid inside of the pericardial cavity. This is going to be a really serious issue if there's an excessive amount of fluid accumulation, as this is going to add additional pressure to the heart. And eventually, the additional pressure is going to compress the heart, and we call that type of condition a cardiac tamponade. With increased pressure on the heart, that's going to decrease the amount of blood that's allowed into the chambers of the heart. That's going to decrease the amount of volume that's allowed to be pumped out of the heart, and that will therefore lead to a decrease in blood pressure and difficulty breathing. One of the more common treatments for the cardiac tamponade is passing a needle into the pericardial cavity and removing some of the excess fluid. So as indicated on this slide, there are three layers to the heart. Namely, and in this order from superficial to deep, they are the epicardium, the myocardium, and the endocardium. So let's get started with the epicardium. The epicardium is the outermost layer of the heart, and another name for this, as we just learned, is the visceral serous pericardium. So the visceral layer of the pericardium and the epicardium are exactly the same thing. You can see that indicated here by having the epicardium in parentheses. So that is our first outermost layer of the heart. The second layer of the heart is the muscular myocardium. Now I like to remember that the myocardium is our muscular layer because myo means muscle. And this layer is also going to be found in the middle, which also starts with an M. So the myocardium, you can see here, is made up of the actual cardiac muscle, and that's going to be making up the chambers and the walls of the heart. The myocardium will be the thickest layer that we will find. To put this into perspective, the myocardium makes up approximately 95% of the entire heart wall. And as this middle layer is made up of muscle, this is going to be the layer that is in charge of providing the pumping action of the heart. It is the contraction of these cardiac muscles that allow for blood to get pumped through the vessels. Now, below this, we have the endocardium. The endocardium is made up of a very thin layer of endothelium that lies upon another thin layer of connective tissue. The endocardium is going to be lining the inside of the heart chambers, and this will be the layer that contacts the actual blood that is found within the heart. Now, myocarditis refers to an inflammation of the myocardium, and endocarditis refers to inflammation of the endocardium. So now that each of the layers of the heart has been introduced, it's time for us to switch gears and start talking about the individual anatomical parts of the heart. So some of you may have seen a heart before. This is what it's going to appear like. But what the heart truly is a series of chambers with that muscular myocardium wall that's going to facilitate the actual pumping mechanism of blood throughout the body. So there are several chambers that can be found in the heart that are going to fill up with blood and eventually pump that blood into subsequent chambers or other vessels. We will find 4 chambers to the heart, 2 atria and 2 ventricles. The atria are found more towards the base as they are more so in a superior position, and the ventricles are going to be found much closer to the apex side of the heart, and that's what we see here. These are showing us the ventricles, and this here is going to be one of the atrium, and it's going to be much more difficult for us to see the other one, but you can sort of see that a little bit up here. So the atria have more of a superior position, and the ventricles have more of an inferior position. Now, I know from this slide there's quite a few terms that are listed on this slide, and by the time we've made it through the entire cardiovascular system, you will know what all of these terms are. So let's start to jump into some of the major chambers of the heart and some of the other anatomical structures that are found on the heart and we'll need to identify. So first and foremost, we have two atria. We'll start there. We have the right atrium and we have the left atrium. And again, just as a reminder, we have to keep in mind that we are looking at the anterior side of the heart. And when we're looking at a patient's anterior view, we have to swap our right with their right. And so therefore, that's why the left atrium is on the right side of the page. If you were to be facing another person, their right side would be next to your left side. So here we can see the left atrium and the right atrium. From the view of the surface of the heart, we can see each of those chambers shown here. The atria and the ventricles are going to be viewed much easier when we start to take a section of the heart, and we will get to that shortly. But I want to first go over some of these structures that are found on the surface. So we'll also find two ventricles. We'll have a right ventricle and we'll have a left ventricle. This here, right in the front, is the right ventricle. See, this is the right ventricle here. And over here we'll see the left ventricle. Now, the left ventricle is actually a much larger chamber and is going to have a much thicker muscular wall, as it is the chamber that will eventually pump into a circulation that has a much higher resistance. So naturally, the myocardium of the left ventricle needs to be larger because it's going to take more power to pump the blood into that circulation. Now, out of all of the anatomical parts of the heart, the chambers are characteristics that we think about being as most essential to what the heart's integrity truly is. But some of the other structures that we see on the heart, just from the surface view of the anterior side, are these large vessels that can be found at the top and also at the bottom of the heart. These large vessels are going to take blood away from and back to the heart as the heart continually pumps blood through the circulation. Now, the first vessel I want to mention is going to be the largest, and this is the largest artery that's found in the body. We call this the aorta. Arteries, in case you were unaware, will always take blood away from the heart, and veins will always take blood back to the heart. So this is going to be the major artery we see coming out of the heart. And all of the blood that specifically leaves the left ventricle will enter the aorta and then travel all across the body. Now we'll actually see that there are three other vessels here, but all of these have a bluish color. We have this one, and this one. And each of these vessels is going to have their own name and is also given the same color for a reason. And that is because all of these are part of our cardiovascular's venous system. So these are veins. They will take blood back to the heart. So you'll see that this here is called the pulmonary trunk. We have the superior vena cava, and we'll find the inferior vena cava. And I'll go ahead and highlight each of those vessels as well. And we don't want to forget highlighting the aorta. Very important large vessels. So the heart actually incorporates two different circulations within it. We have the right side of the heart composed of the right atrium and the right ventricle, and we'll have the left side of the heart composed of the left atrium and the left ventricle. Now each of these atria are going to be connected directly to their ventricles. So blood in the right atrium will directly get pumped into the right ventricle, and then the right ventricle will then pump into one of the large vessels. And same thing's true here for the left side. The left atrium is going to flow into the left ventricle, and that's going to give us an immediate connection between those two chambers. However, blood does not immediately communicate between the ventricles. They're actually going to pump through these large vessels before the blood starts communicating between the right side and the left side. So the superior vena cava and the inferior vena cava are going to be the last two vessels that are going to bring blood back to the heart from the systemic circulation. This blood is going to enter into the right atrium and eventually get pumped into the right ventricle. Now, the right ventricle is directly connected to the pulmonary trunk. And through this pulmonary trunk, we will then enter into a second circulation known as the pulmonary circulation. And that is going to be the circulation that's responsible for going through the lungs and reoxygenating blood. Now, off of the pulmonary trunk, we have to get to two different lungs. And to do this, we will use two different pulmonary arteries, the left pulmonary artery and the right pulmonary artery. So the pulmonary trunk will bifurcate into two other arteries, and each artery will go to an individual lung. There will be a series of vessels that run through the lungs, making up what's known as the pulmonary circulation. So it is strictly the right side of the heart that perfuses that pulmonary circulation. Now, once blood has made it through the pulmonary circulation, it's going to eventually come back to the heart and enter into the left side of the body. The whole purpose of the pulmonary circulation is to reoxygenate blood. So blood that's coming back from the pulmonary circulation will be nicely oxygenated. And it's going to enter back into the left atrium through four other vessels known as the pulmonary veins. We have four of these, one here and one here, and we'll find two on this side, one here and one here. So those are the right and left pulmonary veins that bring blood from the pulmonary circulation back to the left atrium. Now, the left atrium directly connects to the left ventricle, and we'll find that the left ventricle is our more muscular chamber, and that's going to start pumping directly into the aorta. You'll see the aorta has a couple different parts to it, but this will then enter into what's known as the systemic circulation. And this systemic circulation refers to all of the other blood vessels that can be found in your body that perfuse all of the different types of tissues. The systemic circulation begins at the ascending aorta, makes its way around the arch of the aorta, and will eventually descend down and carry blood all the way throughout the body. But eventually, that circulation is going to need to come back to the heart where we can reoxygenate that blood after oxygen has been offloaded to the tissues. So eventually, the systemic circuit will be drained back to the heart by the superior and inferior vena cava. And we make this constant circuit, this constant pathway that blood is taking to get through the vessels. So these are just a few of the structures on the heart that we can see from the anterior side, but I also want to show you what some of these structures look like from the posterior side. So it's also very important that we can identify these anatomical structures from behind the heart as well. Here we can really see the left ventricle is nicely shown, very, very large, and that's going to demonstrate how large the left ventricle truly is. We will also find the right ventricle, the right atrium, and the left atrium that we can see back here as well. We have our superior and inferior vena cava that can be found on the right side, and we'll find the aorta and all of the parts of the aorta, the descending, ascending, and arch of the aorta found over here. But one thing that we don't see from the posterior view that we did see on the front, or the anterior side of the heart, was the pulmonary trunk. The pulmonary trunk is not going to be viewable from the posterior side. But remember, the pulmonary trunk bifurcates into a right and left pulmonary artery. So we can see those pulmonary arteries are actually visible from the back side much better than they were from the front side. Eventually, those pulmonary arteries are going to enter into the pulmonary circulation and reoxygenate the blood that is found in those vessels. And that reoxygenated blood will enter back into the left atrium through the right and left pulmonary veins. Once oxygenated blood has made its way back to the left atrium, that's going to enter into the left ventricle, and then the left ventricle will pump that blood out of the aorta. So I encourage you all to start getting familiarized with these different anatomical regions of the heart. In this chapter, we're going to learn the gross structures of the heart in very, very great detail. So it would be very prudent of you all to make sure you start to learn some of these more apparent structures that can be found on the outside of the heart. As I mentioned, you will know all of these different terms by the time we make it through this presentation, but the ones that I have highlighted are the major terms that are going to get you started as we are about to begin going over the pathway that blood takes to travel through the cardiovascular system.